Hall for this session, which is on combating substandard and falsified medical products in Africa. I'd like to introduce the panelists, if I may.
La régie, si vous pouvez m'envoyer mes images, je vous en serai reconnaissant. Merci. Donc, le ministère de la Santé du Togo, l'OMS.
The Ministry of Health, the WHO Africa region, and the Brazzaville Foundation is welcoming you today to speak to combating, well, drugs that kill. That is what the President of the Republic spoke to us about yesterday. If you recall, he launched a vibrant appeal calling on all who could help solve the problem. Now, we do not need to introduce Dr. Tedros to you again. Director General, he will give introductory comments. We have the Minister of Health of the Republic of Togo, Professor Mijiyawa, and we shall have 3 topics for discussion, and I shall tell you about them in a moment. And we shall be hearing from Mr. Joseph Kabore. He's the Director for Program Management at the Regional Office for Africa, and he is speaking on behalf of our regional director. Madame had to go to another event, and she will be able to join us before the end of this session. Then on the first discussion on the supply chain, pharmaceutical supply chain, we shall hear from Madame Mamessilé Agba-Assih, who is going to speak to universal access to health here in Togo. Then we shall have a second set of discussions. We shall be looking at the various levers that enable us to combat falsified medicines, and we shall hear falsified medical products, and we shall hear from the speakers that I've just mentioned, and we shall hear from some senior officials from the Republic of Togo who are here with us in the room, particularly those who are dealing with combating drugs, and they'll talk to us about interministerial attacks against the interministerial approaches to combat this situation. We shall also talk about norms and harmonizing the regulatory framework. We shall be talking about the African Union's standard regulatory law, which has already been adopted by some countries, and then we shall talk about the AMA, African Medicines Agency, and we shall ask Madame Minata Samaté Cessouma, who is Minister of Health and Humanitarian Affairs, Social Development at the African Union, and Mr. Damiel Gamsije, Minister of Health, as a Republic of Rwanda. As you know, the AMA will be soon established in Rwanda. Let me give the floor right away to the Minister of Health, who's going to say the welcoming remarks.
Merci, cher ami, et Monsieur le Directeur Général.
Thank you, dear friend, Mr. Dr. General WHO, my dear brother, Madam Commissioner of Social Affairs of the African Union, Director Kabore, Madam Minister responsible for universal health coverage, Mr. Minister of Health in Rwanda, dear colleagues, dear brothers, dear sisters, I'd like to say a very warm thanks to all of you and to all of us who have been able to answer present and be here at this major meeting. Indeed, this is an event that is very important, and really we shall see just how important it is as we discuss the points that are ahead of us. We all know about the danger posed by falsified medical products from a health perspective, from an economic perspective, and it's even more of a serious problem because it is so closely associated with financial issues, with money. It kills. And we know, we are very worried because it kills even more than malaria does here in Africa. And it kills, we know this even more because the network of falsified medical products is associated with clandestine networks and mafiosi. And we all know that this is coming closer and closer to us in Africa, and these various dangers, they feed off each other. And because all this represents the heads of state of Togo, along with some of his colleagues, decided that the time had come to grasp the bull by the horns, which led to the Lomé initiative here on the 18th of January, 2020. Therefore, everybody agrees that whatever type of action we take at a national level, it doesn't go anywhere. Within a country, it's not a single sector that can deal with this problem. So it means we all have to join efforts, security, trade, territorial authorities, foreign affairs, all the sectors, in fact, all the sectors that are part of society are concerned. Look at the schooling system today. It's just amazing how there's an increasing number of children who are taking drugs in one form or another. This illustrates the tentacular nature of this problem. And there's also such a wide range of people involved in this. Earlier, my friend Richard was saying that we call on experts, and we find that on a daily basis, they have to combat drugs, they have to combat all forms of trafficking. So we're not going to hesitate to call upon them to help shed light on this as we discuss this matter. So let us say to you once again, welcome. And we shall, as has already been said, do as we did yesterday, which is what we've done since the beginning of this regional committee meeting. We have to say what has to be said. You cannot avoid a problem if you don't look it in the face. So I trust that we're going to do just that, and this will help us all move forward and come up with useful proposals to help our population. Of course, all this has to be done in a harmonized way, in concert with our various partners, the Brazzaville Foundation and the World Health Organization, which I would like to thank warmly. Thank you all.
Merci beaucoup, Monsieur le Ministre. Merci à nous.
Excellency, Mr. Minister, thank you very much. Now, yes, indeed, you said we should say things the way they are.
Director General of the World Health Organization for the opening remarks.
Thank you, Director General Amalvi. Excellency, our host, Minister Mijiyawa, Excellencies, Ministers, Madam Commissioner, dear colleagues and friends. Bonsoir, chers collègues et amis.
Good evening, dear friends and colleagues.
Government of Togo for hosting this important event and for your leadership in addressing the threat of substandard and falsified medicines. I joined you in January 2020 for the same subject, which is very important, and pleasure also joining you at this side event for the same very important issue. The magnitude of this problem and its damage to both lives and to economies is immense. At best, these medicines fail to treat or prevent disease, wasting precious resources and exploiting the hopes and fears of vulnerable people. At worst, they kill and fan the flames of drug resistance, putting all of us at risk. WHO estimates that more than 1 in 10 medicines in low and middle income countries is either substandard or falsified. We estimate that substandard or falsified antibiotics to treat pneumonia in children under 5 years old result in anywhere from 72,000 to 169,000 deaths each year. Similarly, bad antimalarials are estimated to lead to anywhere from 31,000 to 116,000 deaths in sub-Saharan Africa each year. Other examples include falsified cholera vaccines, leukemia drugs that contain simply paracetamol, and faulty diabetes medicines that cause patients to suffer hypoglycemia. At the same time, low and middle-income countries are estimated to spend more than $30 billion annually on substandard and falsified medicines. This is not only public money that's being thrown away, it's being used on products that cause harm to the populations they're supposed to help. Substandard and falsified medical products can be found in illegal street markets, via unregulated websites, and even in pharmacies, clinics, and hospitals. The WHO Global Surveillance and Monitoring System, which has been in place since 2013, has issued more than 70 global alerts to date. Many of these alerts have been issued in Africa. Last year alone, we issued 11 alerts, including 5 for COVID-19 products. How can countries prevent, prepare for, and respond to public health emergencies if they cannot trust their own medicines and medical supplies? There are several reasons for the proliferation of substandard and falsified medicines. First, a lack of access to affordable, efficacious, and safe medicines forces desperate people to buy medicines from unreliable sources. Second, a lack of good governance allows corruption to penetrate health systems and leaves loopholes for criminal groups to exploit. Third, a lack of technical capacity undermines the integrity of supply chains and limits the ability of countries to safeguard the health of their people. Stopping the scourge of falsified and substandard medical products requires working across sectors locally, nationally, and internationally, and working closely with the private sector. Law enforcement through regulatory oversight by mature national regulatory authorities and international cooperation are indispensable to stopping the flow of these faulty products which undermine public health. The COVID-19 pandemic highlights the importance of sharing information and collaboration within global supply chains, including the false information spread by criminal organizations. WHO has been working to combat substandard and falsified medicines for many years. Together with our member states, WHO has developed a comprehensive strategy to prevent, detect, and respond to substandard and falsified medical products. This strategy includes 12 actions, from education to border control, from supply chain integrity to transparent legal process. This is complemented by the Lomé initiative, in which African leaders committed to put falsified and substandard medicines on the highest political agenda. This is the Lomé initiative that was agreed actually in January 2020 in the meeting that I told you earlier. WHO works closely with countries in Africa to strengthen national regulatory authorities and support local production of quality medical products to prevent the use of falsified and substandard medicines. The sharing of data from national regulatory authorities is critical to our joint efforts to stop the trade-off the trade in these illicit, dangerous products. We must change the common mindset that reporting on these bad medical products reflects negatively on countries. We cannot stop this problem if we hide it or pretend it's not there. WHO supports our member states to shift this paradigm so that high levels of reporting are seen not as a failing, but as an indicator of an efficient response to the problem. The Brazzaville Foundation is making an important contribution to this effort by auditing existing legislation related to substandard and falsified medical products. Such strategic intelligence will inform our work in promoting appropriate legal tools and public health interventions. As you know, WHO does not have a mandate to enforce criminal penalties, but we welcome collaboration with national institutions that can bring legal action against the producers and distributors of these damaging products. With the Lomé Declaration and our continued work today, African leaders have sent a clear message that they will fight falsified and substandard medicines aggressively and urgently. But remember, our biggest challenge is ensuring people have access to high-quality, affordable medicines. After all, substandard and falsified medical products only exist because access to quality and affordable medicines does not. By taking focused, concerned action, we can remove the market opportunity for substandard and falsified medicines. The new African Medicines Agency, which will be hosted in Rwanda, will play a critical role in this effort. Thank you all once again for your attention and commitment to this serious public health threat. Our sisters and brothers on this continent deserve nothing less than the highest quality medical products, and that's what we must work towards. Working together, we can build a healthier, safer, and more prosperous Africa for all. You know, in the earlier session, I was supposed to speak, but I couldn't because we were running late, so I didn't. But there were, of whatever I was going to say, there are three things which are very much related to this session I will say. One, as you know, what we're building, whether it's mRNA hub or the BioNTech facility that we did groundbreaking in Rwanda, are very important investments to increase local production, and we have to continue to do that. But in order to increase local production, we need to strengthen regulatory capacity. And that's why the strengthening Africa Medicines Agency is important. But not only Africa Medicines Agency, we have to also strengthen national regulatory capacity. If we do this, not only it will help us for local production, but it will help us to fight substandard and falsified drugs as well. So this is one stone, two birds with one stone. And I would like you to support AMA, Africa Medicines Agency, and also to commit to strengthening your national regulatory agencies. WHO will do everything to increase local production, but at the same time fight falsified and substandard drugs by strengthening AMA. We have already supported financially and through technical assistance, and we will continue to do this, and I would like to assure Commissioner for that. And to all countries here, we are already making progress with some countries to increase maturity level of your regulatory agencies like Ghana, Nigeria, Tanzania, and we're working also with others. We will continue to work to increase the maturity level of your regulatory agency in your respective countries, which will help you to fight substandard and falsified drugs. So this was what I was going to say in the previous session, but I'm glad that the two are interrelated. Thank you so much again. Merci beaucoup, and I wish us a successful deliberation.
Merci. Merci, Monsieur le Directeur Général.
Thank you very much. We will begin with the first presentation on sound. The speaker's sound is not very good. The chair said that we spoke about this yesterday, and the DG has also mentioned it. For each of the delegations, we have distributed to you. We have given you this handout on the screen. You all have it in the files that have been distributed to you. And in the course of our discussion, we'll touch on some of the issues and to collectively underscore the point that we have a shared analysis, which is not to the effect that it's not just an issue of a distribution issue, but also we have an issue relating to human rights, and that's why we are talking about a regulatory, a normative framework. And I made mention of criminals and also talked about the national regulatory authorities. There's an issue of state security, and we know that this trafficking involves criminal networks. We can reflect over this issue as an from an economic standpoint, and we shall be looking at it. The first part of the discussion, which was dealt with in the course of the previous discussion, and we'll not come back to that. That is the pharmaceutical supply chain. Pharmaceutical supply chain, as the Honorable Minister said a while ago, if we want to solve a problem, we have to identify it. So one of the issues is how are we able to guarantee the integrity of the pharmaceutical supply chain, and in so doing, we'll be answering a question that Dr. Moeti during the Lomé initiative asked, that is the sustainability of the pharmaceutical industry, and the director of CHEMEF touch on the sustainability of the pharmaceutical. Microphone, please. Microphone. The speaker has no microphone. Can the speaker speak straight into a microphone, please?
Peut-on monter le son de Madame la Ministre, s'il vous plaît?
La CAMEC Togo, ok, c'est bon.
CAMEF Togo is the platform for procurement of medical products established in 1998, as was the case in many Francophone countries, and is currently a member of the procurement centers. within the context of the devaluation of the CFA, we are having challenges facing up to procurement at a time that essential products are lacking. What we do is to pull our needs together so as to be able to obtain favorable prices. These are basically public health products. It's been said often that we need quality medical products to make it possible for the people to cure their diseases. These products are submitted to the law of the market and therefore depending on the supply and demand. The two aspects on the availability of the medical products is the quantity, and you need a high quantity so as to be able to get an offer, and the price also impacts on availability of the product. Today we are having a problem of having reliable sources, particularly in the COVID context. And when there is a high demand, that automatically impacts on those who want our system to disintegrate. And so we have a system of pre-qualification, pre-selection of suppliers, so as to talk about it before talking about the prices. So we need first of all to talk about the quality before getting into the competition to get the best price. So all these factors take time to study the technical documents, and the WHO has pinpointed this out, that there is inadequacy of human resources to work on these, and it's that the Central Purchasing Agency in this country works together with the Directorate of Pharmacy. So in a way, we have a duplication of efforts, and it's crucial for us to be able to pool our procurement contracts together, as well as the validation process, so as to be able to buy reliable medical products. The second issue, which is linked to the market forces, if the quantities required are inadequate, and unfortunately you are dealing with a product that is referred to as orphaned, and there's no supply, there's no response when you put out such a tender. And in Togo, our population is such that our requirements are small, and sometimes they even ask us if we are buying for just a small hospital. And many suppliers have validated their products before having before responding to an offer. So the Central Purchasing Agency have to buy products that are already registered in the country, and there's a principle of tendering. And in Togo, if the quantity is not adequate, the supplier won't see the need for registering a product over a period of 5 years if the demand is low. So in the African Association for Purchasing, we are thinking of grouped purchases, procurement, and that is the reason why the association was created. But there's an obstacle. Each country has its sovereignty, has its own rules outside the pharmaceutical regulations. These are obstacles that we need to overcome so as to be able to pull certain needs together, particularly the priority ones. We saw that with AIDS, tuberculosis, and malaria, where country needs were centralized, making it possible to negotiate better prices and also better timelines for the procurement. So why can't we, Africans, within a well-structured institution supported by our states, be able to arrive at that situation which will resolve the problem, particularly from reliable sources? Because once you have pre-qualified a source and you have a technical document, that is one of our limitations. Now you move on to the procurement, you place an order, and it is supplied. And sometimes there are very unfortunate situations, surprises, and you find yourself with products that do not satisfy the specifications. You find yourself with such problems. Sometimes you have a product which is delivered and it's correct, but you send it to the laboratory and there are surprises. So these are challenges that we can overcome through intercountry collaborations. The WHO has put at our disposal the NPS system, which assists us a lot. WHO has also worked on pre-qualification of inputs used against priority diseases. But today for our countries, with this need for pharmaceutical independence, we have to own all these, adopt all these so as to so as to be able to set up a regional procurement system. Honorable Minister, in this discussion, we cannot overlook a discussion with the pharmaceutical industry. One of the issues is whether we can establish a pharmaceutical industry to take care of the supply, and also a pharmaceutical industrial value chain. We want to deal with all these problems. Can you tell us what you think about this? Since yesterday, I've heard about courage, political will, leadership on the establishment of this pharmaceutical industry for local production. That is the issue. What are our countries willing to let go to ensure an African pharmaceutical industry to be set up? As I was saying, pharmaceutical products are market products as well, and we need to agree to let go some of our prerogatives. Each country wants to establish on its own country a pharmaceutical industry or pharmaceutical factories. We have to agree that so that there is a distribution so as to ensure our survival. The commissioner a while ago talked about the fact that we have 400 pharmaceutical industries across Africa for about 1.4 billion people. How do we organize ourselves? First of all, that will enable us to have access to essential medicines at good prices. Thank you, Honorable Chair. Are there reactions? Are there delegates here who want to contribute? I'll give the floor to Dr. Ghebreyesus. Dr. Ghebreyesus in WHO Afro, given the tools that are available to support various countries on this issue of dealing with the vulnerability of supply. Thank you, first of all, for inviting me to contribute in an extremely important topic. The DG has said it, and the Honorable Minister as well. We we are talking about pharmaceutical products that kill. The production, the marketing, the sale of medical products that instead of protecting our people, they rather kill them in a very. We also know that there are resilient, efficient medical systems that do not have quality pharmaceutical products. The falsified pharmaceutical products impacts negatively on our efforts and an indirect manner contribute not only to the aggravation of the situation for the people, but to also kill them, as was said. Very quickly, let me give you the figures that were presented by Dr. Tedros in terms of human lives lost, but also economic impact. In the previous panel, I think the delegate of the African Development Bank said 70% of pharmaceutical products in Africa are imported. So, and this is a very big risk, and it is time for us not to only for us to act at the local level, but also at the continental level, so as to find the appropriate solutions. The first thing I want to raise in terms of local action is regulation, in relation to regulation. And WHO supports the strengthening of the capacity building, particularly in countries that do not have adequate capacity to monitor the market and stop pharmaceutical products of doubtful quality. We have, there are some countries that have capacity like Ghana, Nigeria, but I think we can do better. The multi-sectorial action, partnership, cooperation, solid cooperation among countries is indispensable, and that effort is extremely important. And it's within that framework that Dr. Tedros said that the WHO has a monitoring and surveillance system at a global level. Since COVID, with COVID, it made it possible to detect falsified medical products and prevent problems. This cooperation in Africa, we have an example. While we are here, island countries, small island countries, are meeting to set up a mechanism for a pooled procurement of medical products that will take care of their sizes. So we think that the Lomé initiative, while making possible or enhancing partnership and cooperation among countries, is intended to achieve that same objective, and that's why I commended the heads of state yesterday for participating in this Lomé initiative. Of course, we have the critical role of the African agency, the AMA. This was referred to yesterday. Today there are urgent needs. Very quickly, let me make the appeal so that countries that have not yet joined can quickly join in. And I think that will make it possible for us to make some progress. Thank you, Doctor. What are they? What are we able to leverage to resolve these problems? We said a while ago that it's a systemic issue and an issue of rule of law, state security, economic policy, and also public health. One of the major issues that everybody is asking, how are we going to resolve this problem? Shared analysis leads us to the conclusion that we, first of all, need an interministerial action of the states so that each ministerial department can be part of this, can focus on this issue. The Ministry of Justice for the regulatory system to prepare a regulatory framework, the Ministry of Finance, and Ministry of Health. So we need to organize a conference in each one of these countries so as to get the ministers involved. Second, from the analysis that we carried out since the Lomé initiative, there's a need for collective action together with the private sector, the civil society, doctors, NGOs, and religious organizations who play an important role in the health sector. So we ought to be able to deal with these issues. Doctor, do you recall that? Microphone, please. It is extremely important to act, first of all, at the national level. And I think there's a delay in this regard from the agency, the regulatory agencies. We said that with the advent of COVID, countries such as the United States put these agencies in the front line, just as it was the case in Europe. And these agencies that were free to act took actions. But on our side, our countries did not have that freedom to act at the African continental level. Now, the purchasing agencies of pharmaceutical products, this issue, the Honorable Minister talked about it. WHO works with other partners for capacity building along the entire chain to strengthen capacity. We're also talking to other partners such as Africa CDC to give this training and support for capacity building in the various states. And we also need to give the people involved the capacity, and that's why we carry out training and also to ensure that the mechanisms that are set up are effective. The multi-sectorial active action cannot be imposed. There are countries where security situations are serious obstacles. That will be the priority for those states. So we need to have that local contextualized analysis, making it possible for each state to set up its priorities. Thank you, Doctor. Are there any delegations here who want to contribute to the discussion?
Je vois que non. Alors, si...
I see no takers, so perhaps this means we have a consensus, don't we? On all this issue of FSMs. I see the delegation from Ghana is nodding their head. Yes, definitely we have a consensus. Madam Minister, would you wish to say a few additional words on this issue of levers for action? Well, on this matter, in our country, at the national level, beyond capacity building for our regulatory authorities, the pharmaceutical regulatory authorities, we believe there has to be a dialogue amongst the various administrative authorities, in particular those that are covering the entire territory, customs, especially police. It's not easy to get them all to understand each other, but we must admit that over the past few years, we've seen the damage, the harm that has been caused by falsified medical products. So this coordinated action has improved amongst the public authorities, especially at the entry points. Now, when we talk about inter-country cooperation, then we must realize that each country has its own data sources, reliable information about traffickers. And this is a kind of thing that we would benefit from sharing with each other. This would be of great value to the manufacturers, because we know that we need to look at everything that can build trust, and it can help us when there's an emergency situation, be in a position to procure as quickly as possible, because we have quality guaranteed thanks to the information that the various countries have provided each other. I know that WHO has piloted this type of inter-country exchange, but it's not well established. It's not as institutionalized as it should be yet. So this is something that we would work on and make progress with.
Partie de la discussion, justement, avec.
So let's move to the third part of our discussion. We're talking about normative frameworks, strengthening these normative frameworks. And if I may, let's talk about the AMA now. But first of all, we have the Pharmaceutical Model Law, African Union's Pharmaceutical Model Law. We have to, of course, we've just said, have strengthened national laws, but we must look at the continental level as well. And through NEPAD, the African Union has, over a number of years, come up with a model law that's about 20 countries have already adopted. Of course, there are legal systems that differ from one country to the other, common law here, civil law there, depending on whether it's an English-speaking or a French-speaking country. However, countries that, for example, all fall under common law have adopted this model law. You will find the description in the brochure that we have distributed. And you see in the green bubble on the screen, this model law calls for a higher authority, an agency at the higher level that serves as a sort of independent supervisory body for national medicines. And this, of course, gives us the prerequisites for control. We can see in the red bubble what it achieves: post-marketing surveillance and safety monitoring. How many countries have adopted this law, the model law? How many? Rwanda has. Any other countries? Chad? Any others? Senegal. So Benin, yes, we see Benin. So adopting this law is already the groundwork, lays the groundwork for a harmonized continental framework. Now, as far as we're concerned with the Lomé initiative, we use existing legislation that works. We see no point in reinventing the wheel, particularly if everything is taking us forward in the same direction. Now, since we began this session, we've talked about the African Medicines Agency on several occasions. So, Madam Commissioner, it's been created, or it's going to be created shortly, because enough countries that have signed, 7 countries have signed the treaty. Could you introduce this agency to us and tell us how the African Union is going to make it work? Well, thank you very much, Mr. Moderator. What I would like to do to start with is give us a quick historical background to this. I'm not going to speak to the justification for establishing this agency, because be it the Director General of WHO or Mr. Kabore or others have spoken, several people have already spoken about this issue of fake medical products. With the catastrophic the catastrophic effects that this falsified medical products have on our system. So this led to setting up this AMA. In fact, well before 2015, well before the outbreak of the coronavirus pandemic, we, at the continental level, had looked at this issue, and our ministers recognized the need to move forward on this, to fight falsified medical products by strengthening rules and regulations for medical products in Africa, for harmonization, as you've already said, harmonizing the regulatory systems, and most importantly, establishing a medical agency. Beyond the rules and regulations, this agency should enable us move forward. We've already said this here, so that we could produce pharmaceuticals on the African continent. So in February 2019, heads of state and government approved the treaty establishing this agency. And there has been progress. In fact, it's one of the rare occasions in the history of our organization that we've had a treaty that was signed, and within a few months only, we were able to achieve the necessary number of ratifications for its entry into force. Today, there are 23 countries that have ratified this. Of course, we haven't reached the 50% mark for all African countries. However, may I seize this opportunity, since I have the microphone, to launch an appeal to all member states who have not yet become signatory states to do so and ratify the AMA treaty. The very health of our countries and the development of our continent depends on this. So the AMA was established, this treaty has been adopted, and we also are looking at regional economic communities. These RECs are the pillars of our organization, and we cannot work without these regional economic committees and our regional economic communities that contribute at their level to making this all work. And of course, there are the partner organizations. I see that in West Africa, for example, we have the OIF that's doing excellent work, and we shall continue the collaboration that we have with our regional economic communities. You spoke about the model law. I encourage member states to move forward on this. It's not enough that to have 4 or 5 countries. These are documents that are not difficult and or problematic, and we should be able to take ownership of this and move forward with it. If we don't do this, we're going to find that we continue to complain. Yes, we have an agency, but without the harmonization of our various legislative systems, then we cannot move forward. This is the reason we say, let us move in that direction. Let us, I'm not going to bore you by going through all the objectives of this agency, but the key objective is for us to work with all member states. Let us harmonize our legislation, cooperate. Let us produce quality products on the African continent, and this cannot be done without cooperation. In fact, both of these discussion themes are linked. It takes us towards integration, and this is what we need to do for pharmaceutical products as well. Without that, we cannot produce the proper care for our populations. If you wish, I shall give more details about our agency, but I wanted to say that this is a flagship project for our African continent. We have the minister from Rwanda here with us. Rwanda has been selected to host. We had criteria that we carried out an assessment of the countries. We had 13 candidates. 9 of them were assessed based on clear criteria. I didn't participate in the process because I'm the commissioner. We wanted to come up with an agency that was worthy of the name, based on criteria that a lot of countries could adhere to. And then the next stage, after the adoption of the treaty, entry into force, the contracting parties met and designated the country to host it. And then the summit, Lusaka, took place. That was where that took place. The next step is to have a conference of contracting parties, state parties, so that we can have them operationalize this agency. And when I say operationalization, it means we have to set up a board, and we also need funds. And here I'd like to thank the Director General and other partners present here who have given us funding support. And the African Medicines Agency is an extension of what is already being done. We have Africa CDC that, with that team of the interim director, has been working with us, has collaborated. Dr. Benjamin is here with us, and is with us, rather, and we work together looking at the various policies and strategies which will enable us to move to the operational phase, the action phase. And this is how, once we have all this up and running, we can be independent. And I'd like to thank our partners, and in particular, WHO. WHO is mentioned in the treaty because, of course, we are going to have this mother organization cooperating with us and helping us move forward. Thank you. Thank you very much, Madam Commissioner. Yes, I agree with you entirely. Mr. Minister, Doctor, we've welcomed the establishment of the AMA. So what is Rwanda's vision for the future of this agency?
Merci, Monsieur le Modérateur.
Thank you, Moderator. I think, as the Commissioner has just said, Rwanda is one of the countries that ratified the treaty establishing AMA, and therefore that led us to standing as a potential host, and this was done because we looked at the various requirements. What could we offer? Well, the Rwanda had almost 83% performance indicators met, and we continue along these lines. We want this organization to be operational. We shall scrupulously adhere to all these parameters. And since our offer is multi-sectoral in nature, we have set up a committee that is working on all the preparatory aspects for the actual content of our bid to be made manifest, as it were, and the African Union can come and to our country and see that the operationalization comes into effect. When can we expect the AMA to start up? I really have no idea. It's for Madam Commissioner, who's working on the preliminary aspects to guide us there. All we can say is that we're willing to make this agency operational. In our bid, we said we'd met all the prerequisites. We have the structure, we had the people, the human resources, and within a month, we would be ready to be up and running. The building, the equipment, even the laboratory from our own National Medicines Agency would be made available for the AMA whilst pending the construction of the AMA's own laboratory. Thank you, Mr. Minister. I turn to the room. Any comments, any questions? Does any delegation wish to speak to this? Kenya?
Kenya thanks the organizers for this special event in which we are discussing very important matters concerning health products and technologies, and of course the effects of substandard and falsified medicines. There is an opportunity for our African countries to leverage on the existing frameworks under the free trade area to ensure that we can be able to have local regional arrangements so that once the AMA is fully established, these arrangements can be able to now plug into the organization as it is. Because there is an opportunity for regions to set up sentinel pharmacovigilance sites so that there's cross-border monitoring of all the health products and technologies that cross our borders to ensure that we have visibility on what is going through our borders and even reduce the instances of antimicrobial resistance. Thank you.
Thanks a lot for your contribution. Is there another question or comment from another country? Alors, Akam, je vous en prie.
Merci. Donc, je voudrais à la suite.
Thank you. Following on the presentation Madam Minister made, could you speak closer to your microphone, please, sir? Can you hear me better now? Thank you. What I wanted to say was to the panelists, thank you so much. Very interesting contributions. I wish to just say a few words about what ACAM is doing, how we are working on quality assurance. We want to make sure that quality assurance for our population is reality. During COVID, for example, what we did was have training sessions for the 22-member procurement agencies from 22 countries that are members of ACAM. We looked at the false certificates, the fake certificates that were busy circulating, and this prevented quality products from actually being widely available in our country. So this is action that we clearly undertook, and we also supported the COVAX initiative that the OMS had set up. Yes, we participated there. And finally, since the last World Health Assembly, taking into consideration the difficulties central procurement agencies have highlighted, we're in the process of setting up a center of excellence for ACAM. We wish to support capacity, build capacity, and the first training modules will be available from December. What we wish to do is reassure all our participants. We are working in close collaboration with all the players like WHO, but also our supervisory ministries, so that these quality medicines are available to all our population. Thank you. Thank you for that statement, because indeed that reminds me that here in Togo, by the end of this year, we're going to launch a pilot project. And we're going to look at all the solutions that are out there. And having heard you just now, we see that solutions do exist. And indeed, thanks to our collective intelligence, we should be able to pool all our solutions so that we can solve part of the problem. I see our colleague from Togo raise the nameplate. And this is another department. You tell us, it's not the Ministry of Health. Tell us who you are, please.
Je vous remercie.
Thank you, Mr. Moderator. I wish to follow on from what Madam Minister said. She laid emphasis on several other aspects. What I would like to speak to is one aspect of the control strategy, which to my mind is fairly important. It's what we need to do as we reach out to our populations. As you know, one of the weak areas in our systems in relation to these falsified medical products in our countries is a lack of information and the distrust, the fake news, in fact, that is out there when we're speaking about medical products. There's as we mentioned this morning, an infodemic, a whole tissue of lies which we have to combat and look at how we can address this in our strategies if they are to be effective in combating this. We need our populations to turn away from these falsified medical products and not listen to the misinformation that is out there. Now, with respect to the present-day realities with respect to AMA, we have to ensure that sources of medical products are available. Mention was made of how the United States, the Americas, and Europe are so far ahead of our countries, not only in the area of security, but also in the area of making our populations have trust in us. We have the American agency, the European agencies, who were able to mobilize experts and validate these vaccinations. But in Africa, when we communicated with our population, they said, well, how can you tell us that these vaccinations are efficient or efficacious? Well, there was no agency at the time. There had been no agency in place that could, in cooperation with international agencies, reassure our populations. Another point is that we want to ensure that in the near future, we have a regional certification entity. We need a register. Mention was made about accessibility for certain medical products in Africa. And this is because we don't have these registration entities. We need these bodies set up in all our countries. We wanted to mention that. Thank you. Thank you very much.
Thank you. Chad. Thank you for giving me the floor. And before asking my question, I'd like to thank the Honorable Minister of Togo for making such a clear presentation on the issue of procurement of medical products, and also to commend the Commissioner of the African Union on the reminder about the AMA, which has been established to enable us in Africa to ensure the availability of medical products in our countries and generates confidence of our people in us regarding the SF's medical products. In Chad, we have set up a structure for collaboration of police service, customs, to control activities on the national territory. And Kenya has said we have problem at the borders, and so in Africa we need to collaborate to control, to ensure this control and prevent the circulation of falsified medical products in our countries. We also insist that when it comes to medical facilities, all purchases should go through the Pharmaceutical Directorate. And without that, no product will be allowed in. And that works. But unfortunately, there are always the traffickers. And that is where we are trying to redouble our efforts so as to ensure the availability of good quality products for our people. Let me also remind each one of us that we need to be vigilant when it comes to marketing of medical products, because there are a lot of marketing of falsified products. We realize that more and more there are traffickers who are infiltrating delegates and who disorient the population, leading to this situation. So among us as pharmacists, there's a lot to do. We need to meet a lot more, so we are all on the same page and be able to fight this situation. Thank you.
Mr. Minister, you have the floor.
Thank you very much, Mr. Moderator. We sincerely thank the panelists for an insight into this very important topic. The issue of medications, supplies, and counterfeit medicines is a very important thing, even though the day is fast spent, but all of us are very much interested in this topic. Unfortunately, we couldn't contribute during the previous one, but we will throw a few sentences with regards to that. Of course, we are all aware of the fact that whatever control NCDs, communicable diseases, mental health, if we do not have a good supply of medications, we've not started. And unfortunately, that's the reality of many of our African countries, in the sense that supply of medicines and other medical items is a big challenge. In the Gambia, each year, we struggle through a very tedious procurement process, through an international competitive bidding. At the end of the day, there is a winner, and then we await the supplies. Month in, month out, we are told of so many obstacles, shipping problems, the Suez Canal was blocked, the suppliers, they had COVID, and so many other problems. And the ordinary people continue to suffer. The problem is, it goes to quite a number of months, and at that point, you cannot cancel the contract and re-advertise to start. So you rather continue to wait for this supplier who had won this bid. Now, that is a big problem, and we think if in Africa we're able to work together. I was very surprised to have heard that we have up to 400 manufacturing companies in Africa. So why are we not getting together? Where is the problem? And who will bring people together to harmonize, to put our efforts together? Someone has to do so. One pharmaceutical company will not get up and go to join the other one. Who is going to be that link? The African Union is there, the WHO Africa region is there, but I think we need to have these initiatives so that we can leverage on the strengths of each of those groups, so we are able to produce for our continent of over 1.3 billion people. It's ironical that we are still highly dependent on outside countries. Some of those countries are pretty small, but we depend on them to get what we want in Africa. Whenever there is a problem over there, we all continue to suffer. Now, the issue of counterfeit medicines is the same problem. If we were having our own capacity to produce within the region, probably it will be easier for us to monitor. Even when AMA comes into effect and becomes operational, if we are still dependent on the outside world for our supplies, the problems will persist. So we need to look inwards, because as we say, the sale of counterfeit medicines is more dangerous than selling cocaine, because the consumers of cocaine probably know they are consuming cocaine. But counterfeit medicines are given to innocent people who had thought that they were getting the treatment that they require, but unfortunately they end up dying. This is how bad it is. So we really need to look inwards. But I think the major problem is most of our countries do not have the capacity to say it is even counterfeit in the first place. So without those capacities, so we urge the WHO to support countries in developing those capacities. Without that telling us to report on counterfeit medicines, how can we report? We didn't pick it up in the first place to be able to report. So I think we need to look inwards. We need to get champions. I think at various levels, we need to urge the WHO, the African Union, to bring these groups together in the same room. Let us leverage on each other's advantage. One company or one country cannot have it all. But wherever one country is good in, let's support that country. And wherever country number 2 is good in, let's support and then harmonize our strength together for successful Africa. Thank you very much.
Thank you, Mr. Minister. As a future member of the Lomé Initiative, we welcome your contribution, of course, which is so important. Je vais prendre une dernière contribution du Togo.
Let me take one last contribution from Togo. Thank you, moderator. We asked to speak following the brilliant contributions that have been made, so as to give us some further clarification on the national structure used against to fight trafficking and illegal marketing of FSMs. That this involves 2 structures: the national anti-drug structure and the national body against illicit trading and money laundering. It works closely with various ministries, but also associations and NGOs, and acts on lowering the demand, whereas the office works on the repression or reduction of supply. And these activities are across many ministries, Ministry of Finance and Economy, regarding the customs, Ministry of Defense regarding the Army and other security agencies, Ministry of Environment and Forestry for the coordination of activities with Water and Forestry Resources Agency. I can't mention all of them, but I like to mention the Pharmacy and Medical Products Directorate that we work closely with, and our structures are located at various entry points of the territory, be it the logistical chain of the Lomé Harbor, the airport, as well as the land borders. Seizures are considerable, and this structure made it possible for us in 2021 to seize about 70 tons and to arrest and try a number of people involved. This activity at the national level, this coordination, is also plays the role, the interface role among the structures of other countries of the sub-region. And we have several platforms on which we engage in real time and collaborate to enhance our skills and to better know the falsified medical products and also the modus operandi developed by the traffickers to try and go around the enforcement. We heard in your statements that in the months ahead there is going to be a meeting that will focus on this collaboration, enhance it to ensure better outputs. Thank you. Now let me turn to the panelists to ask them for a key word in conclusion. Is there a key word such as pooling of resources? If there is a key word that we can take home, I will say courage. Courage so that our respective states will have the resolve to pool their energies together so we share data on reliable sources of quality medical products. Director, Honorable Dr. Kabore, I would say cross cutting activity, cross-sectorial multi-sectorial activity. Many of the delegates who took the floor made reference to a multi-sectorial action which should be properly structured to contribute to that. Honorable Commissioner, you ask when the agency will be operational. We're working on it. Very soon we'll have the state parties to decide on the way forward. We have the secretariat, the organs, we need the budget. We have an internal procedure and we are working on it. The minister made reference to an agreement to host. They have the draft and we're going to work on that. And also to tell each and everyone, we've taken good note of your comments and I suggest that you upload the AMA treaty on our site just so we can end the challenge of SMFs. The lady from Kenya talks about LECAF. The Secretariat is working with them and we've already had a meeting. But we have this problem, the free movement of persons and goods, which we wish. And these people, while it is good, these people also move around with FSMs. So we need to find a solution to this. And I would also like to thank ACAM, the Central Pharmacy, for what they are doing and for the training, which is also important. This is a comment that I can make while thanking the partners, particularly the partners who are supporting us in this noble endeavor to enable us to end or at least bring down the circulation of FSMs. Honorable Minister, the key word since the legal gap has been filled with this agreement with the host country and a number of countries that are ratifying, it's the more countries we have that ratify the treaty, the more we'll be in a position to deal with this challenge. So I urge countries to ratify. Rwanda is ready and honored by the confidence that you have reposed in us, and we are ready for the establishment of this agency. Thank you. The commissioner urged each one of us to upload the treaty on their website. And the objectives. It's so that each one can adopt that. I think we have all appreciated your readiness to work with us. You are going to leave Lomé in 2-3 hours. Before you leave us, a concluding remark?
Yeah, I think I have said a lot, so maybe I would say what you say, the keyword. I think the keyword would be political commitment of our leaders. Because if there is genuine political commitment, You can share information, you can invest money, you can mobilize international or regional support. You can build capacity, national capacity, it's everything. So I would go for political commitment, and I hope we all understand the gravity of the problem we're facing with falsified medicine, substandard medicine. So that's what I think it matters, a real political commitment that can bring really everything. That's what we need. Thank you, and thank you for inviting me to join you, and thank you for your leadership. Then the last, probably a commitment which I will again say is to AMA. Of course, we have been providing some financial and technical support, but we'll do everything we can to help it take off as soon as possible, because it's an important institution. So you have full support from WHO, Madam Commissioner, and also Minister, Mr. Minister, my friend Daniel. So thank you so much.
To support what you said, dear Dr. Tedros, there is this famous say, when there is a will, there is a way. So we obviously think that everybody will find the way, even sharing the same goodwill. Thanks a lot for attending this event. The Ministry of Health of Togo is inviting us now for a snack outside. So you are all invited to join us for a moment of celebration of this goodwill to find the same way. Thanks a lot.
Thank you. Thank you, moderator. Thank you.
So cute.